Hello, I'm Dr. Eli Ber. I'm a naturopathic physician here in Scottsdale, Arizona. I think we're one of the first clinics to have the Photon Genius. We've been using it now for 3 months, and it's been working wonderfully. I think of all the patients, actually, I'm the one who gets the most treatments, probably because I'm here in the clinic on a daily basis. So I've been doing daily treatments pretty much for 3 months straight. And some of the things that I was doing it for my own health was I have a history of inflammatory bowel disease. There were issues with circulation, which I definitely felt improved after doing the Photon Genius. One of the interesting things is in the beginning treatments, I felt like I wasn't sweating as much. And as I did it more and more, I started to sweat from areas of the body which were showing me signs of improvement for circulation. So I wasn't sweating from my leg area, and now after 10 or so treatments, the legs started to sweat, which I would just naturally equate to improvement in my circulation. It's one of the strange treatments because normally for me, and I don't know about other patients or other people who do the treatment, but when I think about doing a sauna, saunas tend to make me feel tired, you know, and when I'd work out in the gym and go do a sauna at the end, I'd more than likely go home and lie down afterwards because I'd feel tired from it. It wasn't that the sauna wasn't helpful, it's just you know, it would drag me down, as opposed to the Photon Genius, which is a very different experience. And I think what people need to do is have the experience of standing in front of this as opposed to what they're used to as a sauna, and see the comparison, because what happens with the Photon Genius, and this is from my case as well as other patients who've done it, is their energy comes up. And so unlike your traditional sauna where you might feel a little bit tired or lethargic after sweating quite a bit, like you did a major workout or something, your energy comes up. And I have to believe it's probably because of the lymph, having your lymph system pumped at the same time as sweating sort of changes the experience around. And many people have said they're used to going into saunas, they're used to sweating. This felt like a completely different experience in the way that you sweat. It comes out of you, and people who could sweat. I know my father, someone who normally traditionally couldn't sweat. He always felt like but as soon as he got in front of there, the sweat started to appear. And you think that, okay, sweating seems like a mild symptom change, but in reality, not sweating is a major problem for people. It's one of our major organs of elimination. So if we're not sweating, we're not getting rid of toxins properly. So you could see how it could be a factor. I met Warren through my dad, actually, Dr. Eli Ber, and he's just a delightful person. If you haven't met Warren Starnes yet, he's a character. He definitely knows a lot about the therapy. I think he was actually one of the first people to do the therapy on himself, and has a very amazing story to share. The things that I saw, going back to my clinical experience with it, is I did certain therapies prior to having the Photon, and what I did is I incorporated the Photon Genius into those therapies. And one therapy would be the drug detox program that we do here. It's based on a program from Mexico, Dr. William Hitt, who was a biochemist, who came up with an IV protocol for drug detox. And in and of itself was a great therapy. You'd have withdrawal-free detox on that drug, whatever drug they were taking. But it had its share of problems, and many people would relapse very quickly, and they would have withdrawal symptoms even though it was supposed to be withdrawal-free. With the sauna, however, it has changed the therapy quite a bit. And what we saw was really changed my desire to do the therapy. I was almost on the fence about whether I wanted to continue doing drug detox because it was so, you know, people would fall back so easily. With the sauna in place, it hasn't been that way. People are getting immediate symptom relief. They're responding much quicker to the IV. They're not getting detox reactions like they normally would have at the end of the IVs. They're sleeping much better. And so it's, as an adjunct therapy, I think it's superior. It just works so well with the IV therapies that we're already doing. But it's for IV therapies, it seems to potentiate the effects of it, particularly for drug detox. And it does make sense. The sweating out process, I think the Scientology program, which was doing a sauna program as one of the key ways to drug detox, it just seemed like a real shoo-in for that program. So again, people are doing it probably pre-IV. They'll do like 15 minutes of sauna, and then post-IV, about 15-20 minutes, and we sort of made kind of like a package, you know, so people will come and do that. But tremendous results. I mean, if I could actually show you the cases, just seeing personality shifts and people calming down as opposed to like getting ramped up anxiety-wise as they're getting off the medication, just if it did that alone, seems to be quite a bit of improvement for what it was before. Running some cases right now, which are Lyme disease patients. We sort of had a standard protocol of IV therapies, which worked well, but again, the same sort of reactions you get to IVs, right? Die-off reactions, people feeling worse generally after the IV, sort of trying to boost them up as they have to go through the process of killing off infection. Seems to be alleviated quite a bit by doing the sauna. And so, again, originally we were just doing it once a day, like at the end of the IV, but I find it to be good pre and post. If you do the sauna before the IV, well, it's a good setup for the IV because the veins are coming up, and so you can do a nice IV puncture. Plus their energy's up, so they're able to tolerate the treatment. And then when we do it at the end, all the stuff comes out. They're feeling more relaxed. So if we had a die-off reaction, we're minimizing the die-off reaction. It's sort of, I think, an easier way of like maybe doing a colonic therapy, right? People will do colonic therapies as a means to detox their colon. Here we're using the skin, which is a much more simple and less invasive, and I don't think people are jumping to do colonics as much as they would kind of like the idea of standing in front of a sauna because it fits a little bit more their picture of a spa. And I think that has been actually the nicest part is it has made my office more spa-like. So we didn't have any like spa therapies. I don't think people thought their IV therapies were very spa-like, but when you have the sauna in place, people look forward to it, you know, and they leave here feeling refreshed and happy, and you know, the towels and all that, and it just makes for a very nice experience for them here. So overall, I'd have to say I haven't seen any negatives. You know, the machine seems to work well. We don't treat cancer here, but we are getting referrals from other doctors' offices for cancer. The patients that are doing it for that reason all sort of say the same thing. I was feeling really lethargic before, since doing the saunas, and what's keeping them coming in on a regular basis is their energy's coming up. Meaning, and that's also again hard to quantify, but people do like the way they feel after they're done. They feel there's a sort of sense of a clean feeling that people have suggested. I personally remember when I would do intravenous glutathione. It had a very kind of clean feeling too, very similar to this. And so there's like a mental clarity that comes on, and energy comes up. And so the cancer patients that we do see coming in specifically for that, and they're not my patients, so I really haven't had a chance to sort of sit down and find out. But from what I understand, everybody's saying pretty much the same stuff, that their energy seems better, their appetites are coming up, and which would seem like small symptoms, but actually I think for quality of life, it's quite a big symptom. I've encouraged them, even though they're working with other doctors, to do the IVs around the same time as the sauna. So to do a sauna and then go get an IV, I think is probably a good lineup, you know, as far as like making your body more, you know, you would take it in better. I know Warren's story was that he would try and direct the sauna to the areas that he wanted the cancer cells to be killed off. But then he would do the IV, and then he felt that the IV was potentiated by the sauna. And I think that seems like an accurate statement. Yeah, I'd have to say I've enjoyed using it for the past 3 months, and I'll probably enjoy it in the future as well.